we were talking about cardiophobia and how our own Dr. Ish suffers from it. Well, now I'd like to bring into the conversation quadruple board certified cardiologist Dr. Tiffany Sizemore to shed her experience. Welcome back, Doc.
Hey guys, thanks for having me back.
So Dr. Sizemore, how often do you personally see patients with cardiophobia?
Honestly, every single day in my office. I constantly have to balance this anxiety disorder, real cardiology patient, like a teeter-totter every single day. And, it gets real hard when you have someone with real risk factors. So they're diabetic, they're hypertensive, they have a family history of heart disease. And so in those patients, we really do need to rule out that anything bad's happening to them. And then, you get the 20-year-old female that's going through nursing school, for instance, and having panic attacks that are showing themselves physical manifestations, chest pain, palpitations. And so every single day I have to kind of tease through symptoms and reassure someone on a daily basis that everything's okay.
We all experience the sensation of palpitations or being aware of our own heart beating. I mean, that is normal for most of us at times, correct?
Yes, absolutely. And you said it exactly perfect. And this is what I tell my patients. Palpitations is the perception of your heart beating. And what I tell my patients is, I'm not going to tell you you're not having palpitations. My job is to figure out what you're feeling and tell you if it's okay or not okay, right? I hate it when doctors say, well, you're not having palpitations. No, you're having palpitations. It's just, is it bad or is it okay?
We do need to know, walk us through this, Doc, what's the difference between an anxiety attack and a heart attack?
A lot of times anxiety attacks, and I'm sure Dr. Ish can comment as well, they feel more like this overwhelming symptom of heat and palpitations, and you feel like you can't even control yourself. You can't even control your own emotions. Patients, when they're having a heart attack, the vast majority of the time describe a sensation in their chest, like someone sitting on their chest, a pressure. Sometimes they don't even use the word pain. It's more of a pressure or an uncomfortable sensation. They kind of use their hands like this. When patients do this, it's more anxiety. The two hands over the chest is usually more of a chest pain symptom down the arm, up the jaw. But to that point, women a lot of time have atypical symptoms. And that's why I always tell my patients, you know your body better than anybody else. If you feel like something's wrong, you come to me and then I'll walk you through. My line in my office is, don't worry until I tell you it's time to worry.
Perfect. So tell us about some of the treatment options that you can offer for cardiophobia.
So I talk a lot about cognitive behavioral therapy, mindfulness exercises, meditation, and a little trick I do is I will print out, for instance, if I have a patient that just can't kind of get with the program and understand that there's nothing wrong, there's a test called a cardiac CT angiogram, which is essentially literally a photo of their coronary anatomy. And it shows whether they have blockages, what the blockages are made of, how bad the blockages are. So I order this test. It's completely normal, saying your coronary arteries are normal. And that's as good as it gets from a testing standpoint. I make a copy of it and I give it to them. And I say, every single time you feel like you're having a heart attack, you open your wallet, you open your purse, and you read this. And then you remember me looking in my eyes telling you there's nothing wrong with you.
I love it.